ओम धम धन्वंतरे नमः। कर्पूरगौरम करुणावतारम संसारसारम भुजगेन्द्रहारम सदा वसंतं हृदयारविंदे ओम भवानी सहितं नमामि. Let me share. Today's topic is study on electroencephalography. The graphical recording of the electrical activity of the brain is known as electroencephalography. The diseases like epilepsy or seizures or interictal period or to monitor the grade of anesthesia, we can use electroencephalogram. There are waves, different waves like beta, alpha, theta, delta, gamma, etc. On the basis of the changes of waves, we can diagnose the disease. The electroencephalogram is an electrophysiological technique for the reconditioning of electrical activity arising from the human brain. So, electroencephalogram is the electrophysiological technique for the recording of electrical activity arising from the human brain. Given its exquisite temporal sensitivity, the main utility of EEG is in the evaluation of dynamic cerebral function. EEG is particularly useful for evaluating patients with suspected seizures, epilepsy, and unusual spells. With certain expectations, with certain expectations, particularly all patients with epilepsy will demonstrate characteristic EEG alterations during the epileptic seizure, ictal, or during seizure recordings. Most epilepsy patients also show characteristic interictal or between seizure epileptiform discharges, ILDS, term spike that is less than 70 per seconds duration, spike and wave or sharp wave, that is 70 to 200 seconds duration discharge. EEG has also been adopted for several other clinical indications. For example, EEG may be used to monitor the depth of anesthesia during surgical procedures. Given its general sensitivity in showing sudden changes in neural functioning, even as they first occur, it has proven quite helpful in this setting in monitoring for potential complications such as ischemia or infarction. EEG waveforms may also be averaged, giving rise to evoke potentials, EPS, and event related potentials, ERPS. Potentials that represent neural activity of interest that is temporarily related to a specific stimulus. EPS and ERPS are used in clinical practice and research for analysis of visual, auditory, somatosensory, and higher cognitive functioning. EEG is thought to be primarily generated by cortical pyramid, pyramidal neurons in the cerebral cortex that are oriented perpendicularly to the brain's surface. The neural activity detectable by the EEG is the summation of the excitatory and inhibitory polysynaptic potentials of relatively large groups of neurons firing synchronously. Conventional scalp or cortical surface recorded EEG is unable to register the momentary local field potential changes arising from neuronal action potential. This figure shows the brain and its activity. This is the electroencephalogram machine. See the head of the patient, the where various sides the electrodes are attached and the impulses generated are fed to a computer and analyzed, and the computer monitor the waves are displayed. We can take the hard copy of the traces of electrical waves, or we can get the soft copy and the CD. The patient with the EEG machine, the electrodes are attached to the brain head. The brain is a patient which is undergoing EEG, electroencephalogram. You can see in the head the electrodes of the EEG machine attached at multiple sites. And here the various type of waves, delta waves, beta waves, alpha waves, and gamma waves. Brain showing electrical activity. The patient head is attached to electrodes at multiple sites, and the waves are seen in the ECG monitor, the computer displays. The patient undergoing electroencephalogram, the head is attached to electrodes of the machine at multiple sites. The other patient is undergoing electroencephalogram. You can see in the head the electrodes are attached at multiple sites. The other patient is undergoing the study. You can see in the computer monitor the waves. The patient head is attached to the electrodes of the EEG machine at multiple sites. The other patient is undergoing electroencephalogram. You can see the electrodes of the EEG machine attached to the head of the patient at multiple sites, and impulse generated is fed to a computer, and the analyzed and the different waves of the brain are displayed in the computer monitor. The other patient, you can see the patient's head is attached to the electrodes, and impulse is analyzed in the computer to get the tracing. The other patient where the electroencephalography is being conducted. You can see the patient's head is covered by coverage and is attached to the electrodes of the EEG machine, and in the computer display you can see the waves. This is another patient where you can see the patient is undergoing electroencephalogram. The doctor or the technician is operating the machine. The pictorial diagram, a picture showing the electrical activity of the brain. This is a tracing of the brain each electroencephalogram. You can see different waves. So, different waves in this ECG, beta, alpha, theta, delta, and gamma. So, beta waves which have 16 to 30 hertz, and it is in awaken, in aware, when the patient is aware, normal, alert, consciousness will be there. And alpha waves, second one, 9 to 14 hertz is relaxed, calm, meditation, and visualization. That alpha waves are seen. So alpha waves are of 9 to 14 hertz, and it is seen in relaxed, calm, meditation, visualization. Next is theta waves, which is having 4 to 8 hertz wavelength, and it's in deep meditation and dreaming. And delta waves, both 1 to 3 hertz, they see in deep sleep. The patient, where you can see the patient is undergoing electroencephalogram. You can see in the computer monitor the waves. Is somewhat the EEG waves look like. Tracing of a patient is also a patient's EEG. See here, patient is undergoing electroencephalography. So here, patient's head is attached to the electrodes at multiple sites, and the electrical activity is recorded. Here also, patient's electrical activity of the brain is recorded. There are different waves. You can see the different waves of the brain. Waves like alpha, beta, theta, delta, and gamma. You can see the recording of the electron program done in this patient. The picture is at the different wavelengths wave same. So depending upon the change in the waves tracing, we can detect the condition like epilepsy or intellectual period or during anesthesia, different stages in anesthesia. We can monitor anesthesia also with the help of electroencephalography. Here you can see the waves. Gamma waves 30 to 80 Hz, beta waves, second one 12 to 30 Hz, and alpha waves, third one 8 to 12 Hz, theta waves 4 to 8 Hz, and one is delta waves 1 to 4 Hz. Last one is the slow wave. This is the pattern of waves, different waves in the patient undergoing electroencephalography. This is just a pictorial diagram where electrical activity is represented. So another figure which shows the electrical activity. The neuronal network is active during the sleep and awaken state. Neurons, which are the dendrites and axons, attached to the network is formed. So today we have discussed the electroencephalography and its indications. Thank you for patience.